even members of the Pawlenty administration thank me.
We wouldn't include Mr. Pawlenty in that, though, would we?
Well, the governor, no, and I think it's very bad that he's turned down this.
Oh my gosh, just now again
Hundreds of millions of dollars.
With Minnesota's budget strapped the way it is, and we have so many people who aren't able to get medical care in our rural areas.
And I saw the proclamation, and I think he very much misrepresents what the healthcare reform bill is, and the fact that it brings, you know, according to the CBO, that's all we can go on. That's what Republicans and Democrats go on in the Congress. They say it will reduce the deficit, and the whole point of healthcare reform was to address the unsustainability of the increase in healthcare costs. And I'm very proud of the medical loss ratio amendment that I put in, which is now part of the law, which says that health insurance companies that have large group insurance policies have to use 85% of the premiums in those policies toward actual health care. They can use 15% for administrative, profits, marketing, but they have to use 85% for actual health care and 80% in small group and individual policies. And that's a very important cost containment thing. This is not about, this is about being on the side of people who were previously turned down for health insurance because they had pre-existing condition. This is about people who go bankrupt because their health care, they reach their caps, their annual cap or their lifelong cap. This is about security for folks. And it's also about changing the way we do health care. We provide health care to reflect more like what we do with Mayo. If we provided health care with an integrated approach like they do with Mayo, we'd save so much money. And we actually do health care relatively, in Minnesota, very well relative to the rest of the country. I remember having a roundtable where a healthcare economist in Minnesota said to me, you know, in Minnesota we get an A, but that's because we grade on a curve.